You know, when we reach the age of retirement and we start thinking about Medicare and all this, 65 plus, we start thinking about, okay, am I going to need some other supplements, things that necessary that actually are probably unnecessary for you? Well, today on the show, we have brought back in Rita Smith with Patriot Healthcare to talk about some of these situations and things that you do need, you don't need, and the ways that Patriot Healthcare can really help you out. Rita, it's good to see you again.
Good to see you again as well.
Talk a little bit about that. I mean, we've Patriot Healthcare is part of a program that started out in Florida.
Right, correct.
And so now it's moved here to the Mississippi Gulf Coast, Biloxi Gulfport, also in Jackson. So if you have any family members in Jackson, you can pass this along to them. Give us a little background about yourself and Patriot Healthcare.
Well, I'm the Executive Vice President of Patriot and Island Doctors, which is what we're called in Florida. We have over 43 clinics there and 25 to 30,000 seniors that we take care of on a daily basis. We have the #1 product in the state, both performance and seniors and healthcare ratings than any other MSO, which is a medical service organization. Do a really good job, and then we were asked to come into Gulfport after looking at some demographics, and it's very much needed. So we decided to take that opportunity and come here to strategically expand throughout the Southeast.
Now, there are so many things that once a person reaches retirement age, the 65, when they're going to get Medicare, right, that they start having to look at as far as supplemental programs that they, and there's a lot of times, as you had mentioned before, that a lot of these things, they're wasting their money on.
Very much so. I'm a firm believer, that because my father's 80, that I don't understand how we pay for Medicare 30, 40 years of our life and working, and then when we get out, we have to continue to pay for it again. I don't think that's what it was designed for. So I'm a big component of I've earned it and I need to use it, but I need to use it properly. And a lot of times we'll get supplements and things or register for the wrong plan, and we're spending money that we don't need. Statistics tell us that. Statistics tells us that we'll spend 25% of our retirement income on health care that we don't need. And that's very clear. So we don't do that. We're a different type of organization. And our organization focuses on getting people healthy, preventive care, and also bringing them in so we can make sure we do the right thing and it fits their not only their plan, but their pocketbook. So that's kind of
you see a lot of seniors that, that take part, after they retire, then they take part-time jobs. Some of them they do just because they want to remain active, and that's great. I plan on doing that myself, just to, because I don't want to just sit around, unless I've got a good day to go fishing or something like that. But they're taking some of them are taking part-time jobs because they're having to pay for these extra things.
I totally agree with you. We were just having a conversation with some seniors yesterday about that. And again, statistics tell us that nowadays about 90% of most of the seniors that retire will take on an extra job because they have to, not because it's a leisure thing or whatever. When I retire, if I want to work, it means I want to get up in the morning and work when I want to work, and then if I don't want to work, I don't. That's leisure.
Right.
But not to get up and do it. But the fact is, it's because, there are programs out there where they don't have to spend $100 copay on medicine, that we educate them to show them how to get their medicine without being out of so much out-of-pocket money. A lot of people don't teach their members that. We teach them how to use the system to make it work for them. We don't have copays. You can come in our office without a 2 weeks appointment away. But our #1 goal is to get you healthy so you don't have to use those things. I met a woman that was taking 13 prescriptions in a month, okay? And she was seeing doctor to doctor to doctor. She came to us in August. In February, she was only taking 3 meds and had lost 62 pounds.
Wow.
And is out walking every day now. And she was committed to the program. Dr. Roy Hemmon is probably one of the finest senior Medicare Advantage doctors in the country. He's just very committed to that and has programs like our Triangle Diet that takes about a pound off your day for the first 29 days. You know, we got Silver Sneakers program. Diabetes is very big here. So what do? We give you your meter and your strips in the office at no cost.
And you have a program for to quit smoking as well.
Smoking cessation, we have a great program for that. We got about an 87% success rate with that.
That's awesome.
Yeah, and we really
that's one of the
focus
hardest things in the world. You know, my father, his entire life, until he passed away at age 83,
Right.
he started in his mid-teens and smoked.
Right.
And as many different times as he tried to quit, he couldn't quit.
Well, one of the things is it's the preventive stage.
Mm-hmm.
The average patient will see their doctor anywhere from 1.7 to 2.3 times a year. At Patriot and at Island Doctors, we see our patients 9.1 times to 9.3 times a year.
Wow.
Because we get them in as often as possible, which is unusual and it is not normally the practice. But we do that because, remember, our model says we're preventing. We want to stop it before it gets started. And that's why we can say you'll probably live 5 to 7 years longer with that. But we do it at no cost to the patient and all the tests we run and everything. That's on us, just to get ahead of the game.
And free diabetic supplies?
Yes, you get your strips and your meters at no cost when you're with Patriot. You just come in on your day of your appointment, and we give you a new batch, and we check the ones that you did to make sure you're testing accordingly, keep you on track, and we do that, yeah.
That's awesome.
It's great.
And there are so many different things that seniors have to start thinking about
Right.
whenever they, hit 65, and probably should be thinking about it before they hit 65.
Right.
And you have, as you said, you have programs, you have classes that
Right.
people can come to and seminars
Right.
to educate them on, okay, this is what you can do, this is what we can do for you, and this is what you need to know whenever you do turn 65. So you might be 64, 63, and probably a good time to start learning.
64 and 9 months is kind of the target date.
Yeah.
Because you'll start getting 100 pieces of mail a day, and nobody will read them, and you'll get all confused. But whether you come to Patriot or not, come to the seminars, come sit down, come to our office and take a tour and talk to some people and some educators in Medicare, so you can get a really good feel of what you're looking for and what you're going to need, after you're 65. Some people have COPD. We'll take care of it.
All right, and of course you have offices here on the coast in Gulfport and Biloxi.
That's correct.
And
Jackson,
Jackson
right,
as well.
yes.
It's
Thanks,
always a pleasure to
Thanks
talk
for
to you.
having me. It's
And all the
great being in Gulfport.
Yeah, well, it's great to have
Great
you here.
weather.
I know. And all the educational programs you have. Again, if you'd like some more information on what Patriot Healthcare can do for you, call the number on your screen, set up an appointment, and go by and see them, or you can also check them out online.